Hypertension is a major cause of premature death worldwide, and it can actually kill without giving any prior notice. Hypertension, high blood pressure, is a medical term or medical terminology used to describe a situation in which a patient's blood pressure is persistently elevated above normal. I'm Dr. Kayode. The purpose of this video is to answer some of the common questions my patients have been asking me regarding hypertension. Let's get started. Question number 1. What is the normal blood pressure? I've had these questions quite a number of times. Values in medicine are usually given in form of a range. And for the purpose of defining a normal blood pressure, the World Health Organization (WHO) and the International Society for Hypertension gave a value of a blood pressure that is less than 130/85 as being normal. Question number 2. At what point or at what blood pressure do we say someone is hypertensive? The International Society of Hypertension (ISH) and the World Health Organization (WHO) recommended that hypertension should be diagnosed when a person's blood pressure measured in the office or in the clinic is greater than or equals to 140/90 upon repeated measurements, and this value is used for adults or for individuals older than 19 years. How do I know if I am hypertensive? And the answer is simple. Get your blood pressure measured accurately on 2 or more occasions, at least 1 to 2 weeks apart. Find the average of the readings. If the value gotten is greater than or equals to 130/85, you need to see your doctor for further assessment. Thank you. Why do we have 2 numbers while measuring blood pressure? The heart is acting like a pumping machine, which alternates between contraction and relaxation, and we refer to those activities as going into systole and diastole. So when the heart contracts, we say the heart is in systole, and when the heart dilates or relaxes, we say the heart is in diastole. Now notice, when the heart is in diastole, the pressure does not go down to 0 completely, no. But the pressure is only enough to accommodate another batch of blood to flow into the heart so that the heart can pump that blood forward. So when we take our blood pressure measuring machine to measure blood pressure, it measures 2 sets of pressures. 1, the pressure created by our heart when the heart is in systole, that means the heart contracts. And 2, the pressure generated within the heart when the heart is in diastole, that means when the heart is relaxed. And that is why when we measure blood pressure, we usually express it with 2 numbers. One representing the pressure generated when the heart contracts, and the second one representing the residual pressure when the heart is relaxed. So blood pressure is now expressed as systole over diastole. That means the pressure when the heart contracts over the pressure when the heart is relaxed. I have a separate video on how to measure blood pressure accurately at home. I will leave a link to it down below. Question 6. Doctor, what is wrong with me? My blood pressure value varies over a wide range of numbers. Note this, blood pressure is not a constant, and the value rises and falls several times over the course of a day. And this rise and fall of blood pressure is dependent on many factors, like emotion, exercise, posture, diet, especially food that contain a lot of salt or alcohol. However, if the blood pressure of an individual is found to be fluctuating between normal values and a value far above the normal range, then we say that individual has what we refer to as labile hypertension. Thanks for watching the video to the end. Please click the red subscribe button below so that you can get notified each time we release a new video. And please do share this medical education video with your loved ones. Thank you.